If there is gap in outer and inner blood retinal barrier, the dye will leak. Stages include arterial phase, arteriovenous phase, and venous phase.
Next thing is we can see that a vessel is being filled here. That's the cilioretinal artery. Reason why it is filled in this phase is because it is also coming from the posterior ciliary artery. Next is the arterial phase. Arterial phase, we will see the background choroidal flush, but the arterial filling has started. It will not stand out as much as the AB phase, but the differentiating feature from AB phase is now that the veins have also started filling. There is a lamellar flow of the fluorescein dye through the veins. The early and mid venous phase is differentiated because the background fluorescence is further decreased. The veins are starting to appear more clearer, and the maximum retinal artery fluorescence is decreasing now. Also, another thing to note is the perifoveolar capillary plexus is going to stand out maximum here. The late venous phase, you can see that the veins are clearly brighter than the arteries. Perifoveolar network is very visible. The background fluorescence has decreased drastically. So this is a late venous phase. The late circulation phase is going to show a hyperfluorescent picture totally. The background is also appearing hyperfluorescence because of staining. The Brooks membrane tends to get stained here, that is why it is appearing hyperfluorescent, but it is not as bright as the previous images. Also the vessels are hyperfluorescent but not as bright as the first pass. After 30 seconds, the first circulation will be completed. This recirculation phase is mainly to see any staining of the disc or any scarred lesions. The lesions are divided into hyperfluorescence and hypofluorescence. Hyperfluorescence can be without the dye or with dye. Hyperfluorescence appears as whitish lesions, and the hypofluorescent lesions are black. Even if there is an opacity or anything which is not supposed to appear, this is like ONH lucens and astrocytic hematoma, they have intrinsic seeing it around the fovea. There are two keywords important here is that vision will remain constant, but with time the intensity will increase.
Irregular foveal avascular zone indicates macular ischemia. Transmission defect is due to focal RPE loss where hyperfluorescence will be seen. Staining of disciform scar will be seen, and pooling due to stain will escape through the subretinal area. Hypofluorescence due to blocked fluorescence. If there is any visibly corresponding lesion, that is seen in FFA corresponding to it. And preretinal hemorrhage cause blocked fluorescence.
And depending on the individual. Yes, so the round and the regular is properly seen. Okay, here it is not the round, it is distorted. Yeah, why fovea appears black? But there increase in size and intensity. Okay, and this multiple dot fluorescence areas are started to leak and they have increased in the intensity. Foveal vascular zone is wide and distorted, it has remained the same. Such of come on, neovascular. Okay, and the abnormal vessels that are leaking and case of proliferative retinopathy with capillary non-perfusion areas, this kind of areas, and macular ischemia causing wide irregular foveal vascular zone. Okay, then in the late phase, this kind of thing is a white dots are out there everywhere, right? Okay, they are increasing in size and intensity in the late phase, but you are not able to see like a cotton ball like the phase is not round, black material, right? It is a whitish. So this is a particular link of a macular system. Okay. Areas that are linking each other. Okay. This is the same eye in the late phase which shows areas of linking vessels here, and above. Okay, which are not linking but brighter to see. This is a sensitive of loud and clear. Don't worry, it's not an exam. Yes, exactly. So do the non-transactional manufacturing. Okay. Where it's supposed to be around here, this area, there is no vessels, right? So this matters. Yes, pockets of hyperfluorescence are seen. So this is basically a case of CSCR with SR pockets. Those pockets around. These are pockets and piece of leakage. Okay. It comes from. Okay. You are not able to see much clinical details here, but corresponding ICG image you see, you are able to see a proper network fluorescence here. Right. This is basically network of fluorescence here. Okay. You can talk here and directly you can ask here. There will be only a few peripheral vessels and only these kind of peripheral veins will have a laminar flow in that. Okay? Because the inside of the blood laminar flow increases. It means the dye is more of the dye is coming in, so it is covering the entire circumference even though there is a mid cell flow. Okay? AOM will have sectoral leak. Remember this. This is one of the nice examples. And the left eye, sorry, the other. These have some peripheral black areas here, right? So these are basically what we will test as not just a severe inferior. It is neither a proper severe inferior, not a proliferated absent because there are no members. So it is dangerous and can progress to proliferated stage very early. Okay? Ocular ischemic syndromes, CRVO, okay, all this pathology. What is hypertensive retinopathy progress to cause? CRV. Okay, these are hemorrhages known as boat shaped hemorrhage or you able to see, right? So CRVO, yes. Okay, so BRVO,